So I'm here with Dr. Steve Sanchez today. He's a doctor of osteopathy who has been working in Texas, in San Antonio, with long COVID patients. And we wanted to take this opportunity to present questions from our Facebook followers and our other social media followers of the CovidCareGroup so that we can get a doctor's firsthand experience and input on things that are happening right now with long COVID, what the best treatments are, and some other questions that you guys have presented. Steve, why don't you tell us a little bit about yourself?
Sure. So I'm Steven Sanchez. I'm currently a rehab staff physician at UT Health San Antonio with the physical medicine rehab department. I work alongside my supervisor, Dr. Monica Verduzco Gutierrez, who's kind of the godmother of long COVID in our area, if you will, and was fortunate enough to be integrated into this long COVID clinic and, had a chance to interact with a lot of these patients. And turns out that I had long COVID during residency and I didn't even know about it. So I was able to empathize and sympathize with my patients and kind of understand what they're going through throughout this tough time. So it was kind of a good fit for me. And, I've kind of developed my own protocol of how to do things. And so, that's kind of what I've been doing, and I've been having great success with it so far.
I think that's really important to say that you have had long COVID or you have long COVID. I do as well. I've had several post-viral syndromes over my lifetime. I had post-SARS syndrome, and it was really so hard to find care. So that's what brought me to doing the CovidCareGroup, was because I knew people were going to be in for a long journey and that maybe I could help shorten that journey. I'm so sorry to hear that you also have long COVID, but I'm really glad that you're here. And I just want the audience to know that they're getting firsthand empathic or empathetic treatment from us as far as discussions goes, not medical treatment, but we understand where you are. We've been looking for answers. We've been doing our best to contribute to finding answers and moving treatment along. So with that, I would like to just kind of level set where we are. In the CovidCareGroup right now, I have 109.5 thousand followers on Facebook. 5 days ago, I put out a poll asking people what did they want to ask doctors. And in 5 days, I have had 1,252 votes. So I have a lot of questions. And because you are a frontline doctor here and handling long COVID, can we just talk a minute about the word gaslighting? I understand that it has a lot of different definitions, but what I see constantly coming in from the followers is they feel like they've been gaslighted. So, for instance, I've had women going into the doctor's office with their hands shaking, like quivering, and they've been told that they are anxious. And I've even seen 13 women put into a psych ward.
Oh, man.
It's just really tough. So, that's a really severe example, but gaslighting and I think there's some confusion because people expect doctors to know everything, and there's so much unknown about this. So there's confusion, I think, between gaslighting and that. But do you have experience or thoughts on those doctors that just don't pay attention to what long COVID is, or maybe don't really feel like they want to talk about it?
Yeah, 100%. This happens with virtually all my patients. By the time they get to me, they've probably seen a handful of specialists and different providers. And I always tell my patients this. It's not necessarily that they're being dismissive on purpose. It's just that they don't understand it. They don't know how to treat it. And a lot of the times, and I'm sure we'll discuss this later, kind of how my methodology on how I treat my patients, it's that a lot of the times patients come in with a variety of symptoms that just don't make sense. And so it's easy to kind of brush it off and be like, well, let's run a gambit of tests. And most of the time, those tests are going to be normal. That's another thing. I don't order a whole bunch of lab work. I don't order a whole bunch of imaging chasing for something, because most of the time, like I said, it's going to be normal. And so, unfortunately, that's what other physicians do. And when it comes back as a normal result, they dismiss it as, anxiety or depression or, some other type of a psychiatric disease or pathology. But a lot of the times, because I know some of these patients or some of these physicians who send patients my way, and they're like, yeah, they were very dismissive. They told me it was nothing. They told me it was fine. A lot of the time, they're not trying to be intentionally dismissive and kind of, roll their eyes at patients. It's just they don't understand it. And if they're not treating it specifically like the way I do in my clinic, they have very limited ability or very limited capability of handling those symptoms. So that's one thing. And I know a lot of people think that maybe, it's not a real thing. It's a real thing. I know firsthand experience. I was in residency and I was constantly tired. I was sick all the time. I was falling asleep in between patients. And I didn't know, this was before I even knew this was a thing. And, I was being called lazy, that my work ethic was called into question. I almost got fired because I was taking sick leave, more sick leave than my co-residents or my peers. Hearing those types of things kind of gets to you, and it kind of makes you depressed and anxious and sad. But it's not for them trying to be dismissive or trying to make it seem like you're crazy. It's not. They just don't understand it. And that's the only way that it comes across. And unfortunately, that's not the right way to do it. But thankfully, there's providers like ourselves that are able to take in these patients and kind of reassure them and let them know what you're experiencing is valid. Even though you have a normal test result, what you're feeling is what you're feeling, and we need to get through this.
You bring up a really good point where you were being judged for not being hard enough working, where that's probably the thing that made you sicker because you were running on empty and you're still trying to get everything done.
Yeah.
So not only does that happen like with the doctors, but people have it happening in their social circles and in their families, especially if you have a dysfunctional relationship where they're just being accused of not wanting to get better or being lazy. And I had a similar experience years ago after the post-SARS, and I was like, you guys are crazy. I am the hardest working person. I just can't do everything. And that's something that's really important for people to understand.
100%. I was like, well, maybe, you start hearing these things and then you start questioning. It's like, well, maybe I am depressed or maybe something is happening. But no, once I met Dr. Gutierrez and she kind of gave me insights, I was like, yeah, I've been feeling this way. I've been feeling this. She was like, long COVID. I was like, what's long COVID? And I started doing my research. I'm like, whoa, wow, like that's it.
Oh, wow.
So, and then getting a chance to, taking the job and then getting a chance to work with those patients, it's like being able to empathize with them, saying, I know what you're feeling. Like the words that patients need to hear is what you're feeling is valid. What you're feeling is what you're experiencing. Your symptoms are real. Do we know why it's happening? No, we don't. I don't know exactly why everything happens the way it happens. It doesn't. But I know ways that we can try to alleviate those symptoms. And it's a slow process, but we get there.
Well, that's a great segue. You have obviously helped hundreds and hundreds of patients, I would think.
Yeah, a whole bunch.
Yeah, this is exclusively a long COVID clinic.
Mm-hmm.
Yeah, so I'm sure your schedule is very full and has a wait list, right?
Yeah, we're 30-minute slots for follow-ups, 45 minutes to an hour for new patients. And yeah, we're booked for several months out.
Wow. Okay. So can you walk me through a typical intake, like what you're looking for, what you're assessing or evaluating as far as testing, and then after that, maybe your protocol? And the reason I'm asking this is because our followers tend to have a very difficult time communicating the severity of their symptoms, or maybe they're going in and telling the doctor what's wrong and that kind of sets a tone or something, but they really need some guidance on how to talk to a doctor who may not be familiar with long COVID, and those insights that you have would really be helpful.
Sure. Yeah. For initial patient encounter, I always like to get the history. When they've had COVID, how many times that they had COVID, were they hospitalized, what symptoms were they experiencing when they had COVID, what was done, were they intubated, were they ventilated, were they on Paxlovid, were they given IVIG, were they given any type of infusion. All that information is, then I segue into kind of what are you feeling now? What's kind of lingering? What are the things that you're experiencing now? Because it may be a whole variety of symptoms, but I like to kind of tune into about 2 or 3 top major ones that's really debilitating for them. Because if I could get those under control, then some of the other ones, we can fine tune the treatment plan to get rid of those. And a lot of the times when we take care of the top 3, the other ones kind of go away. So getting to what they're feeling now, what has been done in terms of what interventions, any physical modalities, therapies, any type of medications, any type of oral supplementations, any type of diet, any type of thing that they've done that may kind of direct, okay, we've done that, let's try something else. And just hearing like what they feel, everything that they feel is valid. And I think it's important for patients when presenting this information to a physician, especially a physician who does not very well versed in long COVID, is to try to keep things simple. And I know it's a very complex thing of what you're feeling and what you're experiencing, but if you could hone it down to 3 things and being, hey, I'm feeling tired all the time, even though I sleep, or I'm not sleeping well, or I'm sleeping all the time, or hey, I'm feeling pain all over my body. I've taken this medicine and it's not working. This is what I've done. This is what I'm willing to do. A lot of the time in my clinic, patients direct their own care. I give them options. and they direct it. I give them the tools and the information. I don't force them to do anything. I give them a variety of different things that we can try. This is what I've done. This is what's been successful, and understand that it's not a cookie cutter thing. What worked for somebody else is not going to work for everybody. So kind of just giving them the understanding of, what's happening, why they're feeling type of way, and then, letting them direct their own care is important. And when you're approaching a physician, don't overwhelm them too much, because that's when unnecessary testing is going to happen. Unnecessary medication is going to happen. Imaging is going to be ordered. A whole bunch of different specialist referrals are going to happen. With long COVID, you want the least amount of cooks in the kitchen. You don't want everybody with their hands in there throwing different things at you, because then you don't know what's working and what's not. And so that's kind of what I establish with my patients. I say, hey, I'm very conservative. I'm going to do things step by step. Baby step approach. I want to do one thing, and I want to know your experience. Are you feeling better? Is it making you feel better, the same, or worse? And so that way we can adjust. If I do 100 different things at once, maybe you feel better, but maybe you feel worse, or what's working, what's not, what's necessary, what's unnecessary. So just be very simple in presenting what you're feeling to a physician, especially someone not well-versed in COVID. So that way they're not overdoing it, so to speak.
It's something I've been teaching for a few years, is preparing for your appointment. It's really difficult for a doctor, whether they believe in long COVID or not. If you come in and verbally dump everything and you list off 50 different symptoms, that makes it very difficult to weed through. And it's also very difficult to hear. Like it's just so sad and hard to. Yeah. So picking, I like the number of 3 and sort them, prioritize your top 3 symptoms that you need taken care of today. And when those improve, then the next visit, maybe go on to the next 3 or tune it up so that you can make steady progress. And I think that's a really excellent point. Thank you for bringing it up. So when you see your typical patient, are you ordering tests?
So it depends. So if I'm seeing the patient usually by the time I see them, the whole gamut has been done. Things that I order, I'll look for things like mast cell overactivation. I'll look at anything that may be a known cause for fatigue. Like I'll look at a neuroendocrine profile. I'll look at someone's thyroid, testosterone, things that could be fixed with supplementation, with a hormone supplementation, thyroid hormone, testosterone replacement, things that could be easily fixable. I look for, because sometimes those things are kind of overlapped with your long COVID, or, someone who has a autoimmune condition that may not have been, very dominant or very, presenting. They didn't have the symptoms prior to their COVID infection. Then after the fact, they start presenting more with lupus-like flare-ups or rheumatological conditions. Then I'll start digging into those labs. Imaging, unless they're having like things where, heart conditions like POTS disease or any type of tachycardia, I like to rule out, make sure that we're not missing anything big, like a MI or coronary artery disease or stuff like that. So those are the things I will order to rule out big things that we know we can fix. In terms of like looking for specific, immunoglobulins or this or that, like I just don't do that because it's expensive, 1, for the patient. 2, if it is there, what can I do for it? It's like, oh, okay, it's there. Now what? It's like, well, it's not really going to change my treatment plan or my protocol. So why order it? So the only times I order imaging or labs is to rule out big, curable or fixable things that I know that we need to look for. But otherwise, I don't. I tend not to order things.
When people come to you, do they already have a diagnosis of long COVID, or are you usually the person labeling it?
The patient usually has a sense of this is what it is, but I'm usually the first one to actually document it.
I know emotionally that's got to be helping a lot of them, feeling relief that you're acknowledging that and putting it on paper finally. What other benefit is there to having that diagnosis for the average person?
For right now, letting people know that they're suffering from a condition that has multiple symptoms, but hopefully later it'll be more of an insurance qualifier to get certain modalities done. It's one of the big things right now. Long COVID isn't a qualified diagnosis for X treatment protocol or whatever it is, or X medication or X physical modality. So right now it's more for like their understanding that it is a diagnosis, that they do have this. And it's a variety, it's a myriad of symptoms that they're feeling. But I'm hoping that with legislation and different policies that are coming into place that recognize as a true pathology and a true issue going on in the world, that it can be as a qualifier for different modalities that I'd like to enact in my patients.
Yeah, you bring up a really good point. Insurance is so important in this for those who are still working, which a lot of my followers are so sick and they're not getting treatment that they are coming to Facebook and social media for more guidance than they're able to find elsewhere. Some of it's because they don't have insurance or doctors, and some of it's because of the gap with the knowledge. So can we take a moment and talk about your treatment protocol? I know you said every patient presents differently and it varies a little bit, but do you have a core protocol that you use for most of your patients?
So I look at their med list. I always look at their medications and I go over their medications with them. So when we talk about long COVID, we always talk about reserve, right? Their energy reserve, how it's very low. The way I put it to my patients is that our gas tank is never being filled. It's always running on fumes. Even though we sleep and we do X, Y, and Z, we're always just above empty. And so, people think about the physical aspect of energy being drained. I can't walk this far. I can't do X, Y, and Z activities of daily living. My mobility and my gait are impaired because it just takes too much out of you. I always look at the medication and I always educate my patients and I say, taking medication depletes from your energy reserves too. There's a lot of metabolic demands that happen. So you're taking all this medication, it's depleting from that low energy reserve that we have. So my approach is conservative, and I try to wean people off of unnecessary medications as possible. Whether it's, with the exception of maybe inhalers, because I'm not a pulmonologist, I'm not a lung expert. I try some certain things that work and don't work with lungs, but when it comes to like neurostimulants or different type of like Alzheimer drugs that people use nowadays, pain medications, all these different things that have their own side effect profile and their own adverse reactions. And with patients with long COVID, I typically see that they're very sensitive to medications, and adding more medications just makes them worse in terms of like those prescription strength medications. So I tend to gear towards more of a natural supplement route. I've done a lot of research. I've dug into a whole bunch of different things, and I prescribe a lot of over-the-counter supplements by third-party verified supplement companies, and tend to go that route. So I wean them off as many prescription medications as I can, and then start more of a natural supplementation process, and that seems to help them. The one prescription or a couple prescription medications that I do, especially when they're presenting like more of a mast cell overactivation, I'll start them on Singulair, and usually patients just feel a lot better just because of that histamine release, and it just kind of normalizes their histamine levels, and people will stay on it. Other things are like over-the-counter antihistamines, Zyrtec, Claritin. I think that's important. Such as myself, I never had allergy issues prior to COVID. Now I take a Zyrtec every day. Other things like stomach protectants, like PPIs, like Pepcid, that could help lower histamine levels by a different mechanism of action too. And some other supplements that I do, but just kind of depending on patient to patient. It just varies. It varies from patient to patient specifically.
Are there certain supplements that you recommend? I've heard a lot about fish oils and vitamins.
I do a lot of NAC, N-acetylcysteine, for people that have excessive secretions or coughing issues. I do L-arginine and vitamin C for circulatory health. See, what else do I use? Creatine. There's a lot of evidence supporting creatine to help build endurance. I use a whole bunch of different stuff. I use Formula C by Entourage. I use that for a lot of mood issues, insomnia, anxiety, breathing complaints, pain complaints. I use a lot of different things to help, a lot of supplements that have a variety of different things based on my research that have helped people. Fish oil is another one, to PQQ, polyquinolone quinine, that helps with cerebral mitochondrial health. There's a whole bunch. It just depends on their symptom presentation.
These are all really great suggestions, and I bet everybody looking at this is going to run out and try to buy these things. I have never heard of PQQ, for instance, and Formula C I'm just becoming familiar with. So when people are taking these natural substances, really important to check for drug interactions, right?
Of course.
Then you've got your core of prescriptions that are addressed at the histamine release to try to knock that down. And then that naturally would lead to less inflammation, right? Because the histamine cascade causes inflammation.
Sure.
Can we talk about Formula C a little bit more? You're seeing that helping with mood and insomnia, you said?
So a lot of patients who are on antidepressants or pain medication or anxiety medication like benzodiazepines, I'm like, nope, I do not like it. I want you off of it. Just because it just makes things worse. It puts your body in a suboptimal position to kind of heal itself. Formula C, I use it. It utilizes different substances, endocannabinoids, cannabinoids, THC, minuscule amounts of THC. The way I say it to my patients is that it's essentially activating a dormant anti-inflammatory system in our body, which has receptors in virtually every organ in our body, our brain, our lungs, our kidneys, our muscles, everywhere. It helps with insomnia, people who are having sleep complaints, people who have had pain complaints. They have neuropathic or small fiber neuropathy is what we usually see in long COVID. It helps with pain complaints. It helps with anxiety. People, very anxious. I could think of one patient off the top of my head who was just a very anxious person, and started her on Formula C, and she loves it. And she just real calm. I got her off of Ativan. I got her off of Paxil. I forgot which antidepressant she was on, but she's doing great. She was traveling the world with her husband and doing all these things now. Breathing complaints too. People who feel like they're short of breath and not able to take a full deep breath. Formula C helps with that as well. Brain fog. I know cognition is a huge thing. People just feel, the way I'd like to describe it, because I felt this, is I don't know if people have had a concussion, but just kind of like you're there, but you're not there. It kind of feels slow and foggy, and you're just not with it. Like you just feel, that's the best way I can say it, is if you've had a concussion, you understand you're kind of like in this daze, and you feel like you're just right outside your body and you just need to come right back in. It's a weird feeling, but it could help with that as well.
That's fantastic. A lot of people feel like they have dementia, and that's the brain fog. And once you once you reduce the neural inflammation, then the hormone exchange can kick back in. It can produce the hormones, it can absorb the hormones, and it really helps to rebalance more than just your mood. It helps to rebalance everything about you, right? Like your kidney function, for instance. Yes. So really important there.